Okay, today we're going to talk about how to deal with the Foley cath with a patient going into a monoplace chamber. Our equipment here is a urinal, standard urinal, some paper tape, and a sharp object like scissors in order to puncture a hole in the urinal. The main concern here is patients typically with a Foley cath attached to them have air, and most techs are concerned about the air and have to vent the hose for the Foley cath before the patient goes in the chamber, sometimes drain the urine. There are places that leave the Foley cath left open and are hoping that it doesn't spill into the chamber, and there's nothing worse than having a chamber full of urine at the end of each treatment when you got another patient waiting. To simulate urine, we put apple juice into this bag here. This is not actual urine, just so that you know. So we're going to begin. First, you prepare the urinal. Typically, we'd like to take the cap off and snip off the extra fluff there on the side, the front and the back, and then we're going to puncture a hole into the cover. Now this is to allow the hose to be put inside of the urinal. Okay, now you can replace the cap, and to ensure a seal, we'd like to put paper tape around the cap so that it doesn't come off and you end up with a chamber full of urine again. You'll learn this. This is a little tips and tricks that techs use to avoid having a urinated in chamber. There you go, that's beautiful. The next step is to go ahead and prepare the hose. This blanket right here simulates the patient's leg. Typically these Foley bags are strapped to their legs, and what you'd like to do is make sure it's secure on the patient's leg. Now you're going to want to vent the hose, and make sure you have enough hose at the end of it so that it could go into the urinal. Okay. And ensure that it does not, that hose, when it goes into the urinal, it does not go into the handle. As you can see, the handle here has a hole in it, and if that hose goes into that handle and the patient ends up urinating, again, a chamber full of urine, or a patient will get soaked full of urine. What I'd like to do is tape the hose around the urinal to secure it, just to make sure it doesn't come loose. And at times with patients that fidget in the chamber, we'd like to tape it, around their leg somehow with the body of the urinal, or even the handle of the urinal could be taped onto the patient's leg. And we'll let the patients know to be aware that they do not want to be kicking this around because they don't want themselves to be soaked with urine. Now before you start the treatment, at times you'll get an extra urinal and drain the Foley. That's really advisable. That way you have an empty Foley to begin with, and when the patient has to urinate, at least you have all that space in the chamber. And that's how you deal with a Foley cath in a hyperbaric chamber setting.